Good afternoon. I'm Caroline Payson. I'm the Executive Director of the Providence Children's Museum. And on behalf of our board and our staff, I'm really delighted to have you all here this afternoon. For those of you who are new to the museum, Providence Children's Museum has been helping kids connect to their creativity and giving them a sense of innovation and creating lifelong learners for over 44 years. And I am delighted to have you people here, to have everybody here. I'm especially delighted to introduce the governor, who's here to talk about vaccinations for young children, which is something that's very important to all of us. So welcome.
Thank you, Carolyn. Thank you, Carolyn. And I just got a tour, and thank you so much for being the host for a vaccination site, and we're hoping that we get back to a point where you're getting those 200,000 young people, youngsters here right through the museum. So thank you for having us here today, and I'm happy to be here joined with the Rhode Island Department of Health Director, Dr. Nicole Alexander-Scott, pediatrician and president of the Rhode Island chapter of the American Society of Pediatrics, Dr. Beth Lang, along with our Lieutenant Governor, Sabina Matos, and Dr. Carla Martin. So thank you all for being here, joining us to, again, bring a COVID-19 update out into our communities. And thank you for all the media for here as well. So help us spread the word on important information that we're going to share today. So we have many meaningful partners that work, like the Children's Museum, who are making powerful impact on the health of our children and families. Before we preview our 5 to 11 strategy, a vaccination strategy, I want to provide a brief update on Rhode Island's numbers to the people who are watching. Rhode Island continues to lead the country in the number of testing, and that's big for us. Rhode Island has also the second lowest coronavirus test positivity rate in the nation over the last 7 days. We also have one of the lowest hospitalizations per capita over the last 7 days as well. And as I had been suggesting, Rhode Island moved from 4th to 3rd in the nation for population fully vaccinated. And we remain one of the top 5 states in the country for partial vaccinations. Right now, 89% of Rhode Islanders 18 and older have been partially vaccinated. We're getting very close to that 90% goal that we all adopted back in the spring as a team, and it appears as though we'll be reaching that shortly. 69.5% of all Rhode Islanders have been partially vaccinated, and 68% of our 15 to 18-year-olds have been vaccinated, and we still have more work to do, and that's one of the reasons that we're meeting here today, talking about our students in the state of Rhode Island. These strong stats led me to the first announcement of the day, leads me to that first announcement of the day, and some good news to share. The state will be decommissioning the Saconaset Field Hospital. Due to the high vaccination rates, low hospitalization admissions, and the declining impact of the Delta variant, the facility is no longer considered necessary. And that's a very good sign of where we stand in our COVID response and recovery. And as always, we caution if there is some level of a variant, we stand prepared to reopen that hospital if necessary. But at the moment, very good signs, and for us to be decommissioning it at the point in time sends a strong signal that the people of the state of Rhode Island responded in a real strong way to keep us healthy by getting vaccinated and following other protocols that have been in place by the Department of Health for the last year and a half plus. We are here at the Providence Children's Museum today to review Rhode Island's vaccination plan for Rhode Islanders ages 5 to 11. There are about 80,000 Rhode Islanders in that age group, and we're already beginning to expand and tailor our vaccination strategies to be ready to get them all vaccinated. We expect that the Pfizer vaccination rollout for kids will begin in early to mid-November. The FDA is scheduled to review the request for emergency use authorization for 5 to 11-year-olds on October 26th. The CDC advisory panel will meet after that at the beginning of November. Our message to all Rhode Islanders today is our team is prepared and we're ready. We have been working hard to make sure that we have the supply we need and we're able to begin vaccinations as soon as we have the vaccine supply and receive approval. Our 5 to 11 strategy will be a four-pronged approach. We'll have clinics at state-run sites, in schools, community organization-run clinics, and we rely heavily on one of our family's most trusted resources, our pediatricians. Between November and January, each municipality will be asked to hold 2 additional vaccination clinics to focus on this age group. The Department of Health will share a request for clinic link with school nurses and local COVID coordinators, asking them to set up school and community-based clinics. We have reached out to every pediatrician in the state to provide them with information and resources to administer the vaccine. If you are a pediatrician who would still like to administer the COVID-19 vaccine to your patients, please go to covid.ri.gov/healthcare-professionals. You can click and enroll as a COVID-19 vaccine provider at that site. Many of our trusted community pediatricians will be administering vaccines, and we hope this will be universal across the state of Rhode Island. The Rhode Island Rebound Recovery Plan that we released last week proposes investing 10% of the state $1.1 billion in state fiscal recovery as a down payment to improve quality of life and maintain our recovery. Our proposal includes provisions that would support access to and build out networks of pediatricians. All of our kids deserve a healthy and safe upbringing. Bringing down barriers to access to COVID-19 vaccines and flu vaccinations go hand in hand with this work. Our kids will be able to get vaccinated in schools with parental permission, at state-run sites, community clinics, at pharmacies, and of course, pediatricians' offices. This opportunity to protect some of our youngest community members against COVID-19 is right around the corner. Rhode Island will be ready, and I hope you and your family will be ready as well. I'm also pleased to announce that the state will be partnering with the Providence Children's Museum as part of our 5 to 11 strategy. Once vaccinations for this population are available, the museum will offer opportunities for kids and families to come right here to a familiar, safe, and comfortable place to get vaccinated. They will also offer kid-friendly activities during the 15-minute post-vaccination waiting time and opportunities to enjoy the museum. Stay tuned for more information on that. So why our kids get vaccinated, it's very important for the state to support this effort. So why do we want kids to get vaccinated? The COVID vaccine will protect kids from getting severely ill and missing school days, critical learning time. It will get us further along on our path of recovery, and maybe most importantly for parents, it will ease some worry. Keeping our kids in school in person has been and continues to be one of my top priorities. Rhode Island is in a great position to get our 5 to 11-year-olds vaccinated. We had a strong adult and youth vaccination rollout. Now we will do the same for our kids. We know that there are a lot of questions about this vaccine. Pediatricians are a key resource, and we'll be teaming up with the Department of Health to host virtual events where Rhode Islanders can get their vaccinations questions answered. Keep your little ones safe with the COVID shot. That's our message. So I want to thank Caroline again for being our host today and at the Providence Children's Museum.